Hi, I'm Elinor Hiller, and I'm joined by Sean Sullivan. On this Alston and Bird Healthy Byte, we're going to discuss the new payer or health plan requirements under CMS's interoperability rule, which stemmed from the 21st Century Cures Act.
That's right. As of July 1st, 2021, after a 6-month delay due to the COVID-19 pandemic, CMS is now going to allow these new rules to take effect. Specifically, CMS requires certain payers to have application programming interfaces, or APIs, available for patients to access their data and information about in-network providers. First, a patient access API will allow healthcare plan enrollees to use apps or websites to download information about their healthcare claims, encounters, and costs, as well as certain clinical data held by those payers. Second, a provider directory API will allow enrollees to easily pull information regarding their plan's in-network providers, including addresses, phone numbers, specialties, and pharmacy information.
Some payers have had APIs available for a while, in particular for communicating with their network providers. But making APIs available for patients to access their information is relatively new for many payers. CMS plans to enforce these rules with the same mechanisms it uses to enforce other types of contract requirements for regulated plans. The interoperability rule didn't include specific enforcement mechanisms outside of CMS's broader authorities. I do want to note that the new patient access API and provider directory API requirements only apply to certain CMS regulated payers, but this includes Medicare Advantage, Medicaid and CHIP plans, and qualified health plans on the federally facilitated exchanges. And although these API requirements do not apply to non-regulated plans, CMS has stated that it's hopeful that payers will see a benefit of the new API-based tools for patients, and that these types of tools will be offered to commercial plans as well, and the patients in those plans.
And CMS has also mandated that these APIs use HL7 FHIR release 4.01, which is really the technical standard that the health IT industry has been coalescing around for quite some time. CMS hopes that encouraging the use of APIs will allow patients to have a broader and a more holistic understanding of their interactions with the healthcare system, allowing them to take charge of their own medical care.
The new payer API requirements are just one part of the regulatory structure, which is designed to push the US healthcare system towards integration and transparency. Other rules, like those related to information blocking, certified health information technology, hospital price transparency, and HIPAA updates, also promote efforts to provide patients with their own healthcare data and are out there with the hope of leveraging information technology to improve care and manage costs.
If you have any questions on the payer API requirements under the CMS interoperability rule or their impacts on the healthcare industry, please reach out. And thank you for joining us for this Healthy Byte.